50,000 people being laid off over the next couple of days. But what we've done and made really a point of doing today at Cabinet was increasing that pandemic unemployment payment back up to $350, but more importantly than that, aligning the wage subsidy scheme with the pandemic unemployment payment so that employers can afford to and are encouraged to keep people on rather than lay them off. We will provide the employers with the money to do that so they can keep them on the payroll for the next couple of weeks, so those staff won't need to go on the pandemic unemployment payment and will be available to restart work right away again once those businesses can reopen.
Micheál Hennessy from the Journal.ie. Can I start by asking about the bubble concept? I think it'll be welcome news for a lot of people that this is going to be introduced, but it might be helpful to give some clarity on a few points. So can people travel outside of the 5 kilometres to visit their bubble? Can they be indoors together? Do they just have to choose one other household for the entire 6 weeks, or I presume that's not changeable? And does it have to be sort of 2 single-person households, or could, for example, a couple with their children bubble with one of the couple's older parents? Would that be allowed? And then just one other question on weddings. There's obviously an exemption to the 5 kilometre travel restriction if you're travelling to a wedding. Does that mean that you can go to another county to go to a wedding?
First of all, in terms of the bubble, I think just to say that I had consultations last week with opposition parties, and to be fair, Deputy Alan Kelly, leader of the Labour Party, Roisin Shortall of the Social Democrats, were very keen on this bubble idea as well, and concept, which I think New Zealand have worked on, and the United Kingdom. And the idea is to link up with one other household. Okay. And we'll be asking people to engage in good faith on this one. It's important because we have many people living alone in our society, and we were conscious of social isolation. And we're conscious that people who are in such a situation living alone, that they should be able to link up with another household, and then that is your support bubble. That's your extended household, so to speak. And that's essentially it. Obviously it can be within the 5 kilometres or outside of the 5 kilometres. But it's, again, and we are working through that concept, but it's an important one. It's an addition to what we learn as we go along, we learn as we evolve through this virus. I mentioned mental health well-being earlier, that's a factor. So that's why we decided to adopt this and to proceed with this. Your other point was? For the wedding.
To attend a wedding.
Look, in practical terms, if, again, 25 guests, and many people have postponed their weddings, as you know. Those who hung on, if you like, had no expectation that in the next 6 weeks we would be saying to them, you go to 6. So I think we have to have, and it's very difficult, but I feel reason has to break out, humanity has to break out, and I think 25 guests to me is reasonable. There's not, I'm not so sure there's too many more weddings left between now and Christmas, and I think that's the least we could do, to be frank.
So you can travel outside to go. Okay.
Hey, I'm Paul Osford from the Irish Examiner. Taoiseach, you said that we're fundamentally in level 5. A couple of weeks ago, every household in the country was sent out a leaflet which outlined levels 1, 2, 3, 4 and 5. Tomorrow, when people pick up those leaflets, parts of them will be out of date. Is there any point in sticking with a framework that, when written on paper, is wrong? To come back to the schools issue, is there a tipping point in this if we don't see cases come down massively in the next 3 weeks? Is there a review plan for anything to do with the schools? And then just to clarify a couple of things, in terms of the start date, Taoiseach, you said businesses which close tomorrow. Are we closing tomorrow, or are we closing midnight Wednesday? And then in the government's exemptions for travelling beyond 5k, food shopping isn't mentioned on gov.ie. I assume there is an exemption for travelling for food shopping, but just can we clarify that, because there's already been a couple of questions on social media.
I think level 5 now, as the plan, it's very, very close to level 5. You might be a few minor points in the overall scheme of things, but I think people have a real sense of what level 5 means, and it means a very significant lockdown of society and the economy. There are exemptions, of course, and it's not you know, no one wants to be in this position because I think I feel very upset and worried for many, many companies and businesses, particularly non-essential retail, that as from midnight Wednesday will be closing. As Taoiseach said, they did nothing wrong. They did the protocols and so on, and that is deeply, deeply dispiriting for those. So when I said fundamentally this is level 5, it is. On the schools, again, you know, NEFID were clear to us at the weekend that they felt schools were safe places to be in for all concerned. And so therefore, you know, we would like, our view is we should continue on, and we will. And it's the congregation more generally is an issue in uncontrolled environments. I think NEFID have always consistently said the difference between controlled environments and non-controlled environments is key to the spreading of the virus. That if you have controlled environments with social distancing and all of that, you can control the virus. It's in the uncontrolled environments that the virus spreads dramatically. And schools are controlled places with protocols in place and with various guidance adhered to and so forth, and that is key. Taoiseach, do you want to come in?
Yeah, it's government decision is midnight on Wednesday the 21st of October. That's Tuesday night going into Wednesday morning, isn't it?
No, midnight Wednesday.
Wednesday.
So Wednesday going to Thursday, okay. So, yeah, I always thought midnight was actually on the day. But anyway, so I stand corrected. So, yeah, so not tomorrow, the day after.
Yeah.
Although some in practice may do, of course.
And then the exemption for food shopping and you can go beyond 5K. Correct.
Can I just add as well, just on the schools and the importance of that, and what the Taoiseach says about taking a whole variety of factors in, the health of and development of our young people is, and that's, I think everyone understands that, is that it's critically important, particularly for children from disadvantaged backgrounds. If we were to close our schools, it could have a devastating effect. And as well, in terms of any variation from level 5, the primary one in my mind was that one about allowing young people still to train for sports. And I think yes, it is a variation, but I prefer to vary to make the assessment that actually too was a critical need for normal, healthy children to be able to keep going. That I think it was appropriate to make that variation.
Okay. Okay, I'm sorry.
I have to come back in a bit late. It's to follow on to a point that George made earlier. Taoiseach, you said this evening in your speech that the situation now is fairly grave and that the projections are grave, and that is what has required this action to be taken now. Notwithstanding the difficulties and the fact that level 3 was a very significant move in its own right, the argument you made last week was that the country simply wasn't ready for level 5, but this evening you've been able to make decisions on the day to extend and elaborate on the PUP, the extension of wage supports. There is evidence that if the circumstances require, you can take decisions on the night that will, act as something to mitigate the effects of what you're doing. So can I ask you again, given that the transmission for the next 2 weeks is now out of our control and that NEFID are clearly projecting that we're going to have over 2,000 cases a day in a fortnight, do you reject not moving to level 5 a fortnight ago?
No, I think first of all, in terms of, we haven't taken a decision on the night. I mean, this advice came into us on Thursday night. We've given this very careful consideration because of the implications, as we did nearly 2 weeks ago. What I'm saying is we're taking a decision today based on advice we would have received Thursday evening, Friday morning. So we've given it very careful consideration, is the point I'm making, and weighing up, because it's a very serious move. We weren't ready actually 2 weeks ago to go to level 5. For example, the budget has provided a very effective scheme for us in terms of the COVID restriction subsidy scheme, CRIS, as it's called. Why? Because that now deals in a more meaningful way with companies that might have to close longer. Particularly I'm thinking of the hospitality sector, that now will be extended beyond the hospitality sector. That wasn't in place then. And I think, so we wanted to get nuts and bolts put in, but we also wanted to work through other issues from mental health, from our health service. The budget itself was an important set of measures that will enable us to get through this over the medium term, well beyond the next 6 months. Because I think we're going to have COVID-19 with us, Gavin, for the entirety of 2021. That's the point I'm making here this evening. So the timing of an intervention, this is the announcement of restrictions for this phase. And we may very well get the levels down But don't rule out in the next 6 months going back up again to restrictions. And timing is important to give business, to give jobs, to give people a chance to breathe and to live. That's the call. I mean, when we reopened from the first lockdown, we got a reasonable stretch. Being bluntly put, you know, in terms of the economy, in terms of jobs, in terms of viability of companies. As the Taoiseach just said, the whole wage subsidy approach has been to try and not just hand out money to companies, but saying, can we keep the companies viable? Can we keep the employees attached to the companies? And this is really challenging. If you give yourself the horizon, and I don't want to, you know, people are disappointed enough this evening, but we are looking, in my view, that we're dealing with the impact of this virus over the next 12 months. Even if the vaccine comes, and I think we will have some news on the vaccine front before the end of the year, but by the time that vaccine gets distributed and manufactured in sufficient volumes, if we get there, that's going to take a long time as well, you know, period of time. So on the whole, looking at that time frame, you could argue you could have done it 2 weeks ago. I don't think we were ready to do it 2 weeks ago. And I think equally, you know, we're going to come out of this phase. We'll try and maintain ourselves at a lower level then for quite a while, but NEFIT have made it clear that you may have to return to higher restrictions later on.
Okay, can I maybe just put the question another way? I suppose what I really mean is, if all those preparations had been in place a fortnight ago, if you'd already had the budget, if the CRISP was already in place, if you already knew what you could do with the pandemic unemployment payment, a fortnight ago, if all of those supports were there, would you have accepted the advice then?
Yeah, but you see, I would have thought moving to level 3 was absolutely worth giving it a shot. No, make no apologies about that, no. Level 3 is very severe. I mean, we were attacked at the time. I remember we brought level 3 into Laois, Offaly and Kildare, and there was very, you know, very angry responses to it. And I wanted to give level 3 a thing. But the other thing I would say to you is, if I'm honest, I felt at some stage we would have to be looking at higher restrictions in winter time. I was hoping we'd get October, but the virus doesn't respect your own thoughts or your own objectives or indeed the best laid plans. It doesn't. There is some evidence, again, this depends on one's assessment of the difference between testing in the first phase and testing now. The impact of the virus on the first phase seems to have been more significant in hospitals and ICUs earlier than it appears now. That could be due to the fact that we're testing far more now than we did in the first phase. That's one plausible explanation of that. So these are issues you keep on wrestling with if you look at ICUs and so on. Our ICUs are busy at the moment primarily because of normal activities. We haven't suspended non-COVID activities in hospitals and the winter pressures. Some hospitals, quite a number of hospitals have no COVID patients in ICU. Quite a number have one. So it is about managing this and timing this. Yes, I take your point. But equally, we will do 6 weeks here. We will exit, and then we have to plan ahead again, because we're not going into elimination, we're not going to zero COVID, and we're not going to herd immunity. So that's the calls. And look, I'm not saying everyone's going to get it perfect every time, but those are the kind of range of calls we have, I think. Best as a layperson to put it to you, we will continue to engage with NEFIT on this. And I think we had a good engagement on Saturday with them. We had a good engagement, I think, last Monday week. And I think, as Leo said, you know, those are the kind of engagements we need before something is put to you to move. And remember, on the Thursday before that, Saturday, we were told to stay at level 2, or advised to stay at level 2. I don't want to really go back over that. I think we're working together well, and that's the way I want to continue with this. And I think these are calls we have to make. And then there's the wider issues of jobs and people's lives. So I hope that answers the point, yeah.
Taoiseach, the cost of these measures is pretty colossal.
Yeah.
You said your plan is to, you know, suppress the virus and then come out again slowly. How long can we keep doing that for? I mean, how sustainable is this model? And I'm sure you've done projections. How long can the state afford to keep these models or these supports in their current form in place?
I don't want to be referring to any one particular journalist, but I did read Cliff Taylor on the Irish Times, and I thought that was a good analysis. That, you know, he for the first time raised, okay, we get to the end of 2021 or 2021, and then you're looking at, we can do it now. We're in a good position. We can borrow the extra money this year. We can borrow the money for the entirety of 2021. Okay, which will be 20 odd billion.
No matter what happens. Yeah.
We can do it this year. We can do it next year.
Okay.
We need a vaccine next year. Don't talk to me. We'll come back to me on 2022 and 2023. But that's where I say no, and it's a valid point to raise, because you're wrestling with. And remember, a lot of people in health said to us this week, Some people who work at the front line in health said, we want our economy to work to sustain the investment in health services for the next number of years. It's like we're putting $4 billion into health this year. An economy has to produce that eventually to enable us to do that. So we can get through this year. We can add to the deficit this year, which we will now have to add to the deficit over and above what was projected. And next year will be as maybe we'll still manage to come in, hopefully, within the parameters that Pascal and Michael have set. But that's where we are.
Okay, and just Minister Ryan, any changes to how our airports operate? Will be stricter measures there, stopping people coming in, and separately, just in the 5K rule, some people are asking, golf course is a big issue last time. Can you travel outside your 5 kilometres to go to your golf course?
There won't be any. Unfortunately, golf courses will be closed. We will be looking at the issue of aviation at Cabinet again tomorrow. I had discussions today, this evening, with the UK Minister in regard to the measures that they announced today, the UK Transport Minister. We're looking at what the German government is also doing. Each government is actually managing and addressing this. It's very complex, no easy solutions, but we're looking, as we said, to kind of really mirror what's happening in Europe and our neighbours like the UK, which is why I had that discussions with them tonight. Can I just briefly, because I wanted to go back to the economy question, because you're right, there's a real question about can the economy manage this. Well, I hope all those small businesses come back, and as I said, this is with the view to keeping them and get them going, get them through. But there's a wider, longer-term sense I have of the economy, that those economies which are seen to be strong in social solidarity and being able to manage through this terrible virus, every country is facing it, but those countries who actually work collaboratively, collectively and effectively to try and minimise the damage, I think in the long run those are the countries where businesses will succeed more, where investment will come. And it's very difficult, it's really hard, particularly for small Irish businesses caught in the middle of this. But I think actually the correct economic strategy is to show that strength and solidarity, which is what we're trying to do today.
Could I just say that, last Thursday and Friday we had the European Council meeting. The dinner on Thursday evening was quite a depressing affair because it discussed COVID. And as you went around the room, it was the story getting worse in terms of member states and numbers rising. What struck me was, as I spoke to different prime ministers, what are you doing in your country? Very few of them were where we were at that stage. Very few of them, if any, were at level 3 for an entire country. And they were still talking about closing bars and pubs as a lockdown, or a partial lockdown. But what was unquestionably the case is that it was getting much worse across Europe. There are issues that we hope, along with a vaccine, and Europe is working collectively in a coordinated basis on procuring vaccines. Antigen testing is emerging more and more in other countries. NEFIT said to me at the weekend that they're now clinically evaluating and validating antigen testing, which I think is important in terms of dealing with this virus as well and increasing our capacity on top of our PCR testing. So when people are saying how long can it go on, and you raise that point, we have learned we can improve in terms of both therapeutics and treatment of people who get COVID-19, but also in terms of developments like antigen testing and also in terms of the vaccine process itself. And so that would hopefully then enable us maybe to get back quicker than we're currently programming for. Thank you very much. Sorry. Oh, sorry, Philip.
Hi. Can I, number one, just ask for clarity on when are these restrictions actually coming in?
Midnight Wednesday.
Definitely Wednesday, on Wednesday morning, or yeah.
Midnight.
On
Midnight
Thursday.
Wednesday.
Thursday, okay.
Midnight
okay.
Wednesday, yeah.
Thanks. And number two, on all this, there's a lot of talk, and there has been in your speeches and over time and today again, about putting the onus back on people to make all this work and make sure the restrictions come are eased again. You even used the phrase, if people behave reasonably, that you'll think about easing the restrictions. But is there not a reality here as well, that we've become the only country in Europe to go into a second lockdown? And the onus cannot cannot be all on the people or the citizens who have to endure these restrictions. You have to take some responsibility for your botched handling of all the implementation of these. We don't have a deal with the private hospitals. There's mixed messaging constantly. The public health chiefs are being dismissed on one hand, and then they're exact same things they are recommending are introduced weeks later. So surely you take some responsibility, and you can't put it all on the people and say they're the reason why the outbreak and the restrictions are being in place.
Well, that's your opinion. I don't agree with your opinion. I think we've actually, sorry, for the virus? I mean, the virus is a natural phenomenon that spreads when people gather. I'm not blaming people for the virus. People get the virus naturally. It mixes or it spreads very easily where you have people gathering. That's just a reality. No government can stop a virus from spreading. No government can. And in fact, when we're the only country that has been said, right now, others will follow. Wales are about to follow on Friday, is my understanding. Others will follow with more severe restrictions. What's happening here is not unusual in terms of the spread of the virus. It's happening all over Europe, and in many, many other countries in the world it's been worse. I think Asia is probably the most effective continent in terms of the suppression of the virus. I think the early experience they had with SARS was important to them, to the Asian countries, in my view. And I think we've actually, you know, if you look at it from a societal and economic perspective and a health perspective, and when people in later times come to handle it, it will be a better time to judge as opposed to the here and now. But actually we've managed this, I think, in a reasonable way as a country and as a people. You know, economically and socially, and as you go into the latter phase of it, it gets more difficult because people get tired, and people get fatigued, and so on. For the reasons that we've asserted. I mean,
the virus is the same in every other country.
Yeah, and they're now all beginning to bring in restrictions to differing levels. The judgment will be in time. Did we move faster than other European countries, and were we right to do so? Time will tell that, Philip. I believe, you know, given where we are now, we've made a correct decision in line with the advice that we've received. It's a challenging decision. It's not one we like doing, but the virus is the issue here, ultimately. And the virus spreads when people gather. And irrespective of the context or the environment, it will spread when people gather. And that's the unfortunate reality and truth.
Why is it 25 at weddings and only 10 at funerals?
We decided to, because of weddings, there's not too many left, to be frank, it seems to me. And it's difficult, likewise with funerals, I accept that. But we just took a decision in relation to weddings, given that people had planned all year, they've been restricted. We've knocked it on the head, you know, from the original provision, so we decided to allow them at 25. But you see, we didn't want to make it any more complicated. We just took a decision on weddings. The funerals are very, very difficult, but we have many situations in a day. You know, you could have, in one location, you could have many funerals. We just wanted to reduce congregation to the greatest extent possible. There's not a whole lot of weddings happening between now and the end of the year. I think 25 guests for a couple. You know, it's very, very significant there in their lives. I think it's a human thing to do. Sorry? Yeah. Thank you very much indeed. Thank you indeed. Thanks.
If they did more
Those details, we'll go through those details in time. Thanks.